If the patient complains of headache, migraine, tinnitus, deafness or noise in the inner ear, pain and stiffness in the neck, extreme muscle stiffness including restricted shoulder movements, back pain including lumbar spine and pelvis due to misalignment, imbalance, disturbance and dizziness due to functional disorders in the inner ear. If you found these kind of symptoms, then you should consider atlas vertebra syndrome or atlas vertebra misalignment. Myself, Dr. Girisha CM. I am an orthopedic and sports physiotherapist from Promote Health and Wellness YouTube channel. Today in this video, you are going to learn about correction of atlas by effective exercises for the symptoms which normally patient complains with respect to atlas malalignment. Now let us begin with first exercises for the atlas correction when there is a misalignment of atlas vertebra. Now here the patient should be in a sitting, not to lean backside. So see that the neck should be straight and the back should be straight, not supporting the chair. Next is the left hand should be bent, then make a fist so that the back and the left shoulder is aligned. Then after, the neck should be rotated to 45 degree. So always remember the neck should be rotated to 45 degree and looking towards the left fist. Then after, the right hand should be taken and place it at the left ear. So here this is the beginning position where after this we need to stretch the lateral aspect of the neck muscles. We call it a migraine cords or headache cords or the pain which is causing the neck region. So now need to be stretched gently. There should not be jerky movements. It should be slow and gentle stretch. Can you do this? Yeah, when this kind of a stretch happens, so there will be lateral aspect of the neck muscles will get pulled away. So this should be placed for about intensively 2 to 2.5 minutes should be done. And the fourth should be always remember diagonally downwards. Neither the neck should be bent forward nor at the lateral side. Always the neck should be stretched diagonally downwards like this. Here the eye contact should be always towards the fist. When this happens, the patient starts feeling there will be reduction in the pain. If suppose the patient has a 8 in case of a pain scale, so when this kind of a stretching does, gradually patient start feeling pain in the reduction. It may goes to 6 or sometime it may goes to 5. So this should be repeated. When this kind of exercise should be repeated, so there will be alignment of atlas to a normal position. Now slowly release it, take it down, then after slowly take it to the relax. Yes. So this is for the one stretch. Now let us do it towards the other side. The same way the right hand should be bent and make a fist. Then after you need to rotate towards the fist area to 45 degree. Then the left hand should be placed above the head and touching the ear. Then once again gently stretch it diagonally downwards. Remember. Can you do that? Yes. Here the patient can feel the stretch at this area, that is lateral aspect of the neck. So here once again intensively for about 2 to 2.5 minutes should be holding it. Not like regular stretches. Here you should be holding it for about 2 to 2.5 minutes. When you do it correctly, patient feels there will be a relief in the pain. So can you able to feel the stretch this area? Yes. So she is feeling it and always looking down towards the fist. So this will be aligned well so that we call it a headache or migraine pain or the neck pain or the neck stiffness will be relieved. Now gently relax it, take it your left hand, yeah, look downwards, then take it down. So this is the first form of exercises to relieve the upper neck region pain or the stiffness or headache or migraines. Now let us begin with second exercises for the atlas correction. This is once again stretching form of exercises. Here the patient should be in a sitting position, not to lean back on the chair, and the upper back should be straight, the lower back should be straight, not a rounded kind of, and neck should be straight. Here what patient need to do, take both the hands, keep it on the back side of the neck and try to pull it downwards. When patient starts pulling it downwards direction, so there will be stretch at the upper neck region, and it puts lots of pressure on the deeper structures of the neck muscles. Remember, when you are stretching this, the back should be always straight. Back should be always straight. Normally people do mistake of even the back will be stretching it. No, it should be always, the shoulder should be relaxed and the back should be straight. Only the pressure should be on the neck region. When this kind of a stretch happens, it affects on the deeper neck muscles, including the atlas and axial structures. Remember, this is not a small duration stretch. It should be once again done for 2 to 3 minutes. So when this kind of a stretch holds it, remember the pain should not aggravate. If it is a personal pain scale of 10, the patient always should feel at the 8, and gradually patient feels start reducing in the pain due to there will be stretch of the tensile structures. Can you able to feel it? The stretch at the neck region, upper region? Yeah. So here she feels the pain as well as stretch at the upper neck region. So here the patient should be hold it for about 2 to 3 minutes. This will able to feel the stretch of the upper neck region. Now what should do is, after doing this for about 2 to 3 minutes, so need to pull towards left side. So like this, the back should not be rotated. Always remember, back should not be rotated, back should be straight, and neck only should be pulled downwards. How I told you? Diagonally downwards. So when this will be done, so the patient feels there will be stretch at the lateral aspect of the region. Can you able to feel the stretch? Yes. So she is feeling the stretch. So remember, even the lower part as well as the upper neck region will be stretched well. So now then gradually take it towards the other side. So when once again it does, so there will be stretch at the lateral aspect of the upper neck regions. So this will put lots of pressure on the upper deeper structure of the cervical region. Here there will be chances of opening up of a narrow passages where there will be misalignment in the atlas as well as axial vertebrae. So then gradually, if you feel lots of load on the shoulder, you can take the shoulder, how the first exercise which I taught you, the same way can be pulled diagonally downwards. If you put lots of pressure on the shoulder, you can relax like this, then once again you can do this kind of a stretch. So this will help to stretch, as I told you, the deeper structure of the cervical muscles. Then slowly relax, then slowly take it up. So this is the second form of a stretching exercises. Now then gradually you need to sit straight. Then after you need to take the chin up and take your neck as much as back side. Normally patient do complaints of there will be limitation of a neck extension or neck backward movement. So see that, try to take it as much as back side for about 2 to 3 minutes. When this will be happen, so there will be a blockage of movements or restriction of movement can be reduced by doing this. So try to hold it for about 2 to 3 minutes like this. See that the pain should not get aggravated and there should not be any kind of a blackout or giddiness. You are feeling any giddiness?
No.
Okay. So she is not feeling any kind of a giddiness or blackout. So when this kind of a movement does, so there will be opening up of once again narrow passages and there will be increase in the movement of the atlas as well as axial movements. So thereby, so there will be malalignment can be reduced. Then gradually take it forward. When these things will be done, so the lateral aspect of the neck regions as well as upper neck region movement will be improved as well as tensile structures will be reduced. Now let us begin with third exercises for the atlas positioning. Remember, here we are going to use a foam roller, but this exercise will not help to repositioning of the atlas, but this will help to improve the vascularization of the tight structures by releasing the tight structures. Now this foam roller should be placed at the end of the skull area. So here this is the point where the skull ends. From there will be atlas, then after axial vertebrae will be starting. From that point you need to place it and see that you should press it down and roll it slowly downwards. If patient cannot hold it on both the hands, the therapist can do it and roll it downwards firmly. So when this movement does, so there will be lesser vascularization will be improved by doing this kind of a foam rolling. Like this, slowly need to bring it down. So this is in case of forward bending. Now to the other side of the lateral structures like this, need to take it to one side. Here what you need to start is at the mastoid process, where the point of mastoid starts. From there you need to place this foam roller, then try to roll it downward with compression force. When this will be done, so there will be structures at the lateral aspect will be relaxed and thereby there will be increase in the vascularization. Like this should be done towards the lateral aspect. So thereby decrease in the tensile structures. The same way need to turn to other side and need to place it on the other lateral aspect of the cervical muscles. Can you feel there will be relaxation in the neck region? Yes, she is feeling the neck is getting relaxed by rolling the foam on the neck region. Okay. Take it slowly up, then relax. Thank you for watching my video. If you like the video, kindly subscribe my channel. Press the bell icon for a future notification. If there is any suggestion or advice, kindly mention in the comment box. Thank you all. God bless you. Stay safe. Keep moving.